In today's video, we will discuss what exactly constitutes a traumatic brain injury or TBI. How do neurologists clinically diagnose this important condition? What is meant by post-concussion syndrome? And how is persistent post-concussion syndrome clinically identified? Presenting today's session is Dr. Mike A. Popola. Dr. Popola is a board-certified neurologist, neuropathologist, and interventional pain medicine specialist. He is a professor of neurology at the University of Texas Medical Branch and the director of St. Michael's Neurology and Pain Clinics in Houston, Texas. With extensive training, including fellowships from the Cleveland Clinic Foundation and Case Western Reserve University, he is also formally trained in an accredited anesthesia program in interventional pain management from the University of Mississippi. Dr. Popola brings decades of clinical and research expertise to his work. He has published over 115 peer-reviewed scientific articles and led numerous NIH-funded studies. He published highly recognized work using experimental animal models and studied patients who suffered traumatic brain injury, dementia, and chronic pain. His publications are now cited in thousands of textbooks. He is an international leader in the neurosciences. And now, here is Dr. Popola.
Laura, for such a complimentary and nice introduction. So, without further delay, let's move on to our presentation. Let's define what a TBI is, what a post-concussion syndrome is, and how we, neurologists, diagnose these conditions. What is a traumatic brain injury, commonly known as a TBI? A TBI occurs when there's a disruption in normal brain function caused by an external mechanical force. This can happen in a variety of ways, such as car accidents, falls, sports-related injuries, or even assaults. To diagnose a TBI, physicians look for specific criteria, including an alteration in mental state like confusion or disorientation, brief or prolonged loss of consciousness, though loss of consciousness isn't always required, and post-traumatic amnesia, which is memory loss surrounding the traumatic event. Neurological deficits, such as problems with balance, vision, and cognitive functioning, also strongly suggest a TBI. It's important to recognize these signs and symptoms promptly, as accurate diagnosis is crucial for appropriate medical care and for substantiating injury claims in legal settings. I would like to clarify the diagnostic criteria further. A traumatic brain injury requires the presence of an external mechanical force, which does not necessarily have to involve a direct impact to the head. Injuries can also occur due to rapid acceleration, deceleration, or rotational forces causing trauma to the brain. Following exposure to such an external force, only one important concept. Please pay attention because this is an area of confusion. Only one of the following four clinical abnormalities must be present to establish a TBI diagnosis. An alteration of consciousness, such as confusion or disorientation. 2. Loss of consciousness, which may be brief or prolonged. 3. Post-traumatic amnesia. Or 4. The presence of neurological deficits, such as cognitive impairment, balance disturbances, or visual dysfunction. It's crucial to understand that not all of these elements need to coexist. Experts agree that the presence of one single abnormality, like not remembering the accident or having been confused, combined with a history of appropriate external force, is sufficient to clinically diagnose a TBI. Again, loss of consciousness or direct hit on the head are neither required or necessary to diagnose a TBI. After understanding what constitutes a traumatic brain injury, it becomes essential to recognize a common clinical presentation known as post-concussion syndrome. While healthcare providers typically encounter TBI patients shortly after the event, many professionals, including providers from non-neurological specialties, and sometimes attorneys, often meet individuals later when they present with persistent symptoms consistent with post-concussion syndrome. This is important because, as we will see in another video, the symptoms of a post-concussion syndrome are mostly subjective. They are often interpreted as psychological problems, when indeed they are the product of a physical, organic injury residing in the brain. Because most routine tests, including CT scans or MRIs of the brain, can be normal, family members, even other doctors, often from non-neurologically related specialties, fail to diagnose these patients. They often attribute the symptoms to psychological reasons or, worse yet, fabricated ones. This situation can be devastating to many patients. Neurologists rely on clinical criteria to diagnose PPCS, looking closely at symptom clusters that impact various aspects of daily life. Common symptoms include persistent headaches, cognitive impairments such as trouble concentrating or memory loss, dizziness, fatigue, emotional disturbances like anxiety, depression, or irritability, and sleep disturbances. These symptoms can dramatically disrupt an individual's life, leading to personal frustration, family stress, and diminished occupational or academic performance. Please realize that because symptoms are diverse and often subtle, early recognition and proper evaluation by a neurologist are essential. If there is uncertainty or persistent concern about ongoing symptoms after a traumatic injury, referring the individual to a neurologist can profoundly impact their long-term well-being, preventing unnecessary suffering and potentially tragic outcomes.
This concludes today's presentation. We have time for one or two questions for Dr. Popola.
Dr. Popola, if symptoms of a traumatic brain injury can't always be corroborated by routine exams or MRIs, how can you objectively demonstrate that these symptoms are neurological in origin, rather than psychological or subjective?
That's an excellent question. In cases where routine neurological examinations and standard imaging techniques, such as MRIs, don't clearly capture the extent of brain injury, neurologists rely on specialized neurophysiological assessments. These include tests such as evoked potentials, quantitative EEG, and computerized posturography. These advanced methods are often more sensitive than standard MRIs or even sophisticated imaging techniques like diffusion tensor imaging. Critically, these neurophysiological assessments provide objective data that cannot be voluntarily manipulated by the patient, thus reliably distinguishing neurological deficits from psychological or subjective factors. We'll cover these powerful diagnostic tools in detail in an upcoming video.
Thank you for joining us today. If you found this information useful, please like and share this video and subscribe to our channel for more insights on traumatic brain injury and neurological care. Please note, this video is intended for informational and educational purposes only and should not be used for self-diagnosis or treatment of any medical condition. If you have health concerns or symptoms, always seek direct medical advice, diagnosis, and management from a licensed healthcare professional.